Ryan is a 37-year-old female who presents to the walk-in clinic complaining of headaches for the last few weeks. Headaches are described as vice-like, involve the entire head, are constant in nature, and occur every day. Nothing is reported to aggravate symptoms, but Tylenol and Motrin have been used to relieve the pain. Currently, pain is rated at about a 2 or 3 out of 10, and she denies changes in vision, sensitivity to light, dizziness, nausea, or vomiting. She does report some neck stiffness and some muscle tension in her neck. And she also reports stress at work and being kind of overwhelmed and exhausted related to the demands of her job. Her physical exam was negative, and her blood pressure was a little elevated today. So my differentials for her include a tension type headache, migraine or a mixed tension and migraine headache, and a possible secondary diagnosis of hypertension related to the elevated blood pressure. So the reason why I think the primary diagnosis is tension type is because of her symptomology. She describes it as a lot of pressure all across her head. It's not in a localized spot, and she's experiencing a lot of stress and a lot of muscle tension as well. She's not reporting any signs of a migraine like sensitivity to light with the photophobia or phonophobia. It's not unilateral or throbbing, and it's not severe pain. Therefore, I don't think it's related to a migraine or a mixed of the two. And for her secondary diagnosis of hypertension, for it to be classified and diagnosed truly, she would need to come back and have it elevated on more than one occasion, but the high blood pressure is likely related to her environment with stress. For probing, I would ask my preceptor, are there other pertinent findings or questions that could point to another differential? And so my plan for her would be to continue her PRN use of the Tylenol and the Motrin. And really the big focus is lifestyle management for her. She's going to need to be able to find just small amounts of time to do some relaxation exercises, do a lot of stretching with her neck and maybe her upper back muscles, her shoulders, because a lot of the times it can be the true cause of the headaches. Also trying to find time to exercise and getting adequate amounts of sleep. We want to follow up with her in about 3 to 4 weeks just to check on the blood pressure, and if she's able to log it at home and, just keep track. And if she's having elevated, then she'll need it to be treated. So for self-directed learning, I would like to do some more research on some red flags that are associated with headaches so I can better recognize them and also teach them to patients so they know when to seek emergency care.